talk about shared decision making and why is it so important for patients to work closely with their healthcare team on choosing a therapy?
Because these are therapies that last for a long time. And hopefully, the patients and the relationship lasts for a long time. And so, I think that everybody has to be comfortable with the decision about a therapy. And my personal goal is always to try to make sure that everybody understands the rationale for a therapy, the potential ups and downs with a therapy, which every drug has, every approach has. And what I'm kind of watching and monitoring, I think that communication relieves a lot of anxiety. I think that the unknown is far scarier than the known, even if it's not perfect. And so I think shared decision making has a role in relieving some of the scariness of unknown. Is like if we're discussing to come to a decision, that means that my job is to give you the knowledge that I have so you can tell me the knowledge about you and what you're feeling and what you want back. And that back and forth is what helps me do a better job taking care of the patient and helps the patient understand what's going on and relieve some of the stress of the unknown. So I think it's a very synergistic approach. I don't think I could practice medicine in another way.
Managing the worry associated with a diagnosis or concerns even about progression can lead to a lot of anxiety and fear amongst patients. Why is it important for them to share what they're feeling with their healthcare team?
I mean, I would say this, if our goals are to have people, this is what I say to patients, like, I want you to think about this disease when you're here. And then when you're not here, my goal is to have you not thinking about this disease because you're feeling okay and you're comfortable and confident in what's going on. So I want to make it a clinic visit disease. That's not always possible. But for many patients, it is. I don't want somebody to start thinking like a sick person when they're not. I don't want the diagnosis to be the disease, right? I want the person to, if they're feeling well, to recognize that, live your life, move on with things. But at the same time, these kinds of diagnoses are scary. And so it is normal with a new diagnosis or a change in the diagnosis to go through a period of time where you have to adjust. And so that's normal, and you have to work your way through it. Some people want to work that all out internally, and that's good to a certain extent, as long as they have good supports at home. But I also often want to know how they're doing, how they're working through that, so I can get a gauge of how it's affecting their life and the duration where this adjustment is going on. So somebody who's still adjusting to a new diagnosis 2 years after the diagnosis and they're otherwise clinically well, that's getting into the range where it's not normal. You might need additional help. You might need counseling, and in some patients, that might include some medications for a short period of time. The goal is to have the disease affecting you only insofar as it's affecting you, not the idea of the disease. So, that's it's a conversation. There are lots of resources. People being individuals deal with things in their own way. And I just try to help understand with them how it's affecting their life. And if it seems to be more than I would expect, I'll tell them that. And then we can discuss that. It doesn't mean we have to do something today, but I will tell them, I think this is, maybe a little bit more like, why are you so worried? And, I think you're doing great.
Yeah. Can a social worker or somebody else on the healthcare team help with these emotional needs that patients have?
Absolutely. We have great social worker. I tap into them all the time. We also, have a group of psychiatrists who are really interested in, the kind of psychiatry that's related to oncology and the diagnoses and how it impacts care. I mean, this is New York City, so everybody has a therapist, but a lot of patients have pre-existing connections to healthcare providers or support systems.